Bismillahirrahmanirrahim. Assalamu alaikum. Farooq Hassan is back with a brand new episode of Sky is the Limit. Today I am at Children's Hospital, Lahore, and I am going to introduce to you a very senior medical professional. We are going to meet Dr. MASOOD SADIQ. He is a very decorated professional, and he also has the honor of being the founder vice chancellor of the first ever Child Sciences University in Pakistan, which is going to be formed here in Lahore. Dr. MASOOD SADIQ also has the honor of being the dean of the second largest children's hospital in the whole wide world. Yes, that's correct. Pakistan has the honor of having the second largest children's hospital in the whole wide world, very much in Lahore. So we're going to learn a lot from Dr. MASOOD SADIQ, see his journey, see his progress, and the latest developments in child sciences. So let's go and see him. Viewers, I have with myself Dr. MASOOD SADIQ, a renowned medical professional, Tamgha Imtiaz. He has contributed a lot towards the field of medical sciences, specifically child health sciences in Pakistan. And we're going to talk to him, talk about his journey and how he reached here and what his contribution to the field of medical sciences in Pakistan and what is his vision for the future. Assalamu alaikum, Dr. Sir.
Walaikum assalam.
Such a pleasure meeting you after a long time.
Same here, Ji. Thank you.
Things have changed, things have moved on. Last time I met Dr. Sir, he was heading the Children's Hospital, which incidentally I even didn't know at that time is the second largest children's hospital in the whole wide world. And he was heading that, and now he has the honor of being the founding vice chancellor of the Child Health Sciences University, first ever in Pakistan. So Dr. Saab, congratulations.
Thank you, Ji.
Amazing accolades. Primarily, Pakistan has two basic issues. One is health and one is education. And you happen to be, part of one of the issues, which is the health issue. You're catering to that. So we'll talk about Children's Hospital first. Obviously, child health has been a slightly neglected issue in Pakistan when we talk about health in general. So you've been heading Children's Hospital for a long time, and this is the second largest children's hospital in the world. How was the experience? What was the condition when you joined? How is it faring now? Could you just brief us?
Thank you. First of all, let me clarify. When we say health and education, actually they are interrelated.
Okay.
And we as professionals are actually part of both health and education because we deal with health education.
Okay.
And being a professor or being a part of an institute or a university, you are directly involved with the education as well. And when we talk about child health, actually, I totally agree with you that this somehow has been ignored or overlooked in Pakistan. We are one of the largest pediatric population in the world. You will be surprised that in the last census, which was carried out a few years ago, 47.8% of Pakistani population is under 18 years of age.
Okay.
And World Health Organization now defines a child as somebody who is 18
less
or
than
less.
18 years old.
So almost 50% of the population of this country is actually pediatrics or child health.
Okay.
So and I think very rightly people say that if you have healthy children, you have a healthy nation.
Absolutely.
And unless we work on child health or pediatric health, we are not going to be a healthy nation overall.
Fair enough.
Now, coming to the context of Children's Hospital, as you very rightly said, this is one of the largest children's hospital on the globe. The only other hospital, children's hospital, which is bigger than Children's Hospital Lahore, is Ho Chi Minh City, Vietnam, which is about 1,800 beds.
That's the largest hospital in the world.
That's the largest hospital on the globe.
And how many beds do we have?
We have 1,160 beds in this institution.
Okay.
But it has certain unique features, and I must tell you about that. We have an institution where we have 38 clinical departments.
Okay.
Now, when you talk about adult health, you say there's a cardiologist, there's a nephrologist, there's a similarly, when you talk about pediatric health, you talk about a cardiologist, a nephrologist, a neurologist, a endocrinologist.
All the same
all
faculties.
the same specialties which exist in medicine, surgery, and diagnostics actually exist in child health as well. but there's actually on top of that certain other things as well, like neonatology. Neonatology means babies under 1 month of age.
Okay.
Now, that doesn't exist in adult population.
Okay.
You can say geriatric population, because then once you get older, then you can be similarly development. Now, there's a full-fledged developmental pediatrics or behavioral pediatrics department in the institution. That's again something which particularly relates to pediatric population, because that's only relevant to pediatric population, because you have development milestones as you grow older. So I think this concept of children's hospital in this this was a brainchild of late Professor Saidul Haq.
Okay.
He was the one who conceived the idea of children's hospital in Lahore. He worked very hard, and he was the founding project director of this institution as well.
Must be your teacher.
Yes, well, he was one of the teachers of many people in around. So I think we must give credit for this institution to late Professor Saidul Haq.
Okay.
And another person who really needs a special mention here is Professor Sajid Maqbool, who was the first dean of this institution, because whatever academic atmosphere and the institute, the concept of an institute of child health really started when Professor Sajid Maqbool joined this institution. Now, unfortunately, in Pakistan, unlike many other countries in the world, we do not have that setup where children are actually seen in a children's hospital. You go to US, you go to UK, actually general practitioner for a child means a child specialist.
Yes.
You go to UK, which is a population less than Punjab,
Yeah.
and they have 13 children's hospital.
Yes.
So a long time ago, I gave an idea to then Chief Minister Punjab that we should at least have a children's hospital in every divisional headquarter of Punjab.
Fair enough.
And I'm happy to say that at least there are now two more, one in Multan, which is close to 500 beds, and another one in Faisalabad, which is about 250 bedded children's hospital in Punjab.
Okay.
But if you look at the country as a whole,
Yes.
which has a population of 220 million, of which I think over 100 million are children,
Yes.
There's one small children's hospital in
Quetta, yeah.
which was almost the same time as this hospital.
I think the Japanese collaborated and
Germans collaborated.
Germans collaborated
With that, and I was so sad to see the condition of that hospital when I visited Quetta a couple of years ago. That hospital, unfortunately, for whatever reasons, could not
sustain itself.
could not progress the way Children's Hospital Lahore has progressed.
Okay.
The Japanese collaboration, which you are mentioning, was actually in Islamabad.
Okay.
The PIMS Islamabad has within a bigger hospital a small setup which is a children's hospital, and that was a Japanese collaboration.
Fair
And then we have another one in Karachi, which is called National Institute of Child Health,
Okay.
which was a federal government project, but now has been taken over by the Sindh government.
The provincial
And you will be
government.
surprised still. The KPK does not have a children's hospital. It's under construction, and we are supporting them. We have been advising them as how to make
It's
that
going
hospital.
to be part of a bigger hospital?
No,
or
no,
is
it's
it
a
separate
standalone children's hospital, which
Like
is
Children's Hospital
just
Lahore.
Lahore, which is under construction at the moment in Peshawar.
Okay.
The whole Gilgit-Baltistan area doesn't have a children's hospital. Kashmir doesn't have a children's hospital.
Okay.
So I think it's something you very rightly said, that pediatric population has not been given the same status, I would say,
And I'm amazed,
as the adult population.
I'm amazed that 47% you mentioned of population of Pakistan is
pediatrics.
And we do not have enough medical facilities.
On a lighter note, I think you have cardiology institutes at every place.
Yes.
Because by the time you become a powerful politician or a bureaucrat, you have a heart problem. So everybody wants to have a cardiology institute, but when it comes to children, it sort of gets to the back burner.
That
because
was on a
that's-
lighter note, but you are absolutely right. I think like heart diseases, obviously, and with the kind of dietary habits we have, that's a very common ailment that we have in Pakistan. That's why we have so many.
No,
institutes.
we have unfortunately very terrible figures.
Yeah.
I must admit that I'm sure you are aware of Sustainable Development Goals,
Yes.
SDGs,
Yes.
where we have to bring our neonatal mortality to about 12 and under 5 mortality to about 25. Can you imagine what our current mortality is? When we say neonatal mortality, it means mortality of babies under 28 days of age.
Uh-huh.
And we have one of the highest in the world. We are amongst the top 3 nations who have highest neonatal mortality in the world.
And what is the basic cause?
Well, there are multiple causes. One is prematurity. Many of our children are born underweight. Second is infections. Many of them get infected. They get septicemia, they get pneumonias, they get many other But the worst of all is birth asphyxia. Birth asphyxia is that your baby's brain does not get enough oxygen at the time of birth because the delivery is done by not a trained professional. It's still being done by birth attendants who are not adequately trained. It's done at homes. It's not done in a hospital. Quacks. So more than 40% of our deliveries are still being done by traditional birth attendants in the country. So that major chunk of babies, unfortunately, not only that many of them would die, many of them would have a lifelong brain injury. And that brain injury would then reflect into developmental delay. They will not be able to go to schools. They will have difficulties all their life, and they cannot contribute to the society as one should be doing.
So
infant mortality, also one of the highest. We have about 65 per thousand live births infant mortality. Under 5 mortality still very high. Then 1/3 of our population is stunted.
So when you say high, you're comparing it with the world figures, right?
Well, not only with the world figure, with the surrounding countries figures.
Okay.
Countries like
Southeast Asia,
India, Bangladesh, Nepal,
so
we are lower. They are far better off than us in terms of all these parameters like stunting. Those children who do not attain adequate height as compared to their and weight as compared to their age, about 40%. Anemia, the one who has low hemoglobin and cannot, is about 1/3 of our children are anemic.
Right. So Doctor, even now I hear sometimes that specifically children with certain diseases which cannot be catered here in Pakistan, they have to travel to neighboring countries to get themselves treated. There was a major trend back about, I think, a decade back. It has gradually come down.
Yes.
What's the reason? We do not have enough facilities.
No, I think that particular trend at that time was related to my specialty. Actually, I'm a pediatric cardiologist,
Yes.
and there were many children with heart defects who used to go to India for surgery.
Okay.
And because we did not have a cardiac surgeon.
Okay.
But then I think we made an extraordinary effort. We convinced a Pakistani who was actually from Karachi.
Okay.
And asked him, Dr. Asim Khan, I would name him because
Okay.
he has really contributed to this specialty tremendously.
Okay.
We convinced him to come to Lahore, and I'm extremely grateful to then Dean Professor Sajid Maqbool and the Chief Minister at that time because he was not Punjab domicile.
Okay.
And the argument we gave to the Chief Minister was that if a Pakistani can be employed in UK and USA, why not a Pakistani be employed in Lahore? Even if he doesn't have. So the then Chief Minister relaxed the policy and he was appointed here as pediatric cardiac surgeon. And then this specialty really evolved. Now hardly anybody has to go out of this country for any surgery because all such facilities are available at Children's Hospital Lahore, at many other centers in the country because they have now trained many people who are actually working around the country.
Great. Doctor, this Children's Hospital, is it a free of cost facility
yes.
for everyone?
We provide 100% free treatment to all admitted children in this institution, be it cancer, be it bone marrow transplant, be it cardiac surgery or any other treatment which is very, very expensive. Still we manage, and I think more than 90% contribution comes from the government of Punjab. Of course we have donors. We have many Pakistani who have a very big heart for children, and if you run into any difficulty or problem, they are always there. There are many institutions, organizations who support children with heart problems. They support children with cancer. They support children with other illnesses like nephrology, those who have kidney disease and so on. But I think majority or over 90% of that contribution of free treatment to children is government of Punjab.
You have an endowment fund also?
Yes, we do have an endowment fund which has recently been created because we attained the status of university very recently. But otherwise it has been government of Punjab, I must admit.
The credit goes to. And children with all kind of diseases, including cancer or serious ailments, can get admitted here and get treated here?
We have a non-refusal policy, and that's sometimes you become victim of your own success. That's what I say, because sometimes you see pictures on the television, they would say, oh, there are 2 children on one bed, or there are 3 babies on one bay. The reason for that is that we are like a Supreme Court for this country. Any baby who gets unwell and cannot be treated anywhere in the country is referred to Children's Hospital Lahore.
Okay.
And we get referrals from KPK, we get referrals from Azad Kashmir, from Sindh, from Balochistan and so on, even Afghanistan. And these children come here, we have a non-refusal policy.
Okay.
But I think the good thing is that you have a human resource. We have a faculty which is over 100 now. All super specialists in various specialties who have been either trained locally or internationally, and in that context we have MOUs or collaborations with international organizations, international hospitals. We are trained with York Hill Children's Hospital, Glasgow.
Wow.
That was in 2001, renewed in 2018. We have MOUs with many institutions in UK, USA, and rest of the world where our trainees can go and get training, part-time training. Their people come. So the exchange of knowledge, exchange of training, and that happens. I must admit, rather I must mention a couple of things here.
Yes, for young doctors?
For young doctors as well, and for the institution as well.
Yeah.
First for the institution. We are doing bone marrow transplant.
Okay.
Now, bone marrow transplant is done for children who have cancer and certain other rare blood disorders.
Okay.
We are the only public sector institution in the country who are offering bone marrow transplant free of cost. Again, credit goes to government of Punjab.
It's a very expensive treatment.
It's a very expensive treatment.
I know that, I've heard about it.
And free of cost, and our specialists are not paid any extra for that. They are paid the same amount of money as anybody else is being paid.
Service.
They do a service there. And we have done over 100 bone marrow transplants in this institution. Similarly, cochlear implant. Cochlear implant is something which you put in ear those who are deaf, under 5 children. Again, the money comes from Chief Minister Office, because Chief Minister Office has established a special cell for that, and they pay for the device because it's very expensive device. But our team does it free of cost.
Okay.
And we have done hundreds of cochlear implants in this country. Similarly, neonatal infant cardiac surgery. Children who are under 1 year of age, not many institutions in the country are offering that surgery. And Children's Hospital takes lead in that context as well, because we have within this hospital, we have an Institute of Pediatric Cardiology and Cardiac Surgery. Okay. So we are the largest pediatric cardiac center in the country.
Wow.
Having sort of 4 surgeons, 7-8 cardiologists, and the entire team which is really working towards that.
We see very few Pakistani specialists or doctors in any field going and giving lectures internationally, training other doctors, whereas this trend is very common in West, Europe, America and all. What's the reason behind that? We have so much talent here, so many brainy doctors. What's the issue?
The way the system runs in this country is very unfortunate. I always say it's unfortunate. The reason is that most of us actually work from 8 to 2:30 in the hospital. Then because you are not paid adequately, then you have to spend time and do your private practice. And that takes away your peak time of your life. When somebody criticizes private practice, it upsets me the most, because you are giving the best time of your life to patients for which you were trained. Of course, they pay for it. I'm not denying that fact. But the fact that you actually giving best time of your life to patients, I think should be credited rather than discredited. So what that leaves behind is that majority of people do not have enough time to actually work. To be recognized internationally, you need to publish. Research. And that's the only way, research and publication. Okay. If you go to the West, they say either you publish or perish.
Either you publish or perish.
Wow. Because in academic setup, you are no more recognized if you do not publish. Now, publishing here, living in Pakistan, working in this environment, and then publishing at an international level where you can publish in an impact factor journal which will be recognized internationally is not an easy thing to do. Okay. And I think I've been extremely lucky, because I was in UK for 5-6 years, and you develop that acumen where you know how to do it, how to write it, and then we were able to alhamdulillah write in different journals.
How many publications do you have?
I have over 100 publications in index journals, and alhamdulillah, I've been invited to all over the world in various international conferences, representing not only Pakistan but being an eminent pediatric cardiologist. I have over 80 presentations worldwide as an invited speaker.
Wow!
And I think that's something which our youngsters need to aim as well, because unless you really publish and you are recognized, if I say this is the largest children's hospital on the globe, nobody would know that. They are not interested how many patients you see and how many patients you treat, unless that data is extracted and translated into research and publication.
Awesome. What kind of occupancy rate do you have here at the Children's Hospital?
It ranges anywhere from 125 to 150%. Okay. Certain departments it goes to 200, 300% sometimes. And the reason for that is that there are certain areas, like on a day, if you are admitting 300 to 400 children a day, that's our average. We see around 1,500 children in our emergency every day, and 2,500 to 3,500 children in outdoor every day.
Okay.
And we have 1100 beds, and on an average there are 1600 to 1700 babies admitted at one time in this institution. So there will be areas like neonatology, general pediatrics, cardiology, gastroenterology, where you would find two patients on a bed, rarely even 3 patients on a bed.
So
on a day when it's your emergency day and you have 60 beds and there are 180 children, then you don't have a choice but to put them on
share
the. So our young doctors work very hard. I must admit that, because when you are given the numbers in terms of strength, that's based on beds.
Yes.
And nobody cares whether you are admitting 1800 or 2000 children.
And obviously
on
whoever
that.
comes to the hospital is in pain and he wants to be treated and he doesn't care.
And that sometimes obviously creates problems as
Yes,
well, because
obviously.
Criticism
Yes,
and people, because if you are sharing with 2 other children, then of course you are definitely sort of compromising certain things.
That's part and parcel of the job. Healthy children will form healthy nation. Healthy nation will form healthy Pakistan. So we need to have a focus on this area that Dr. Saab is talking about. I'm still in conversation. We're going to talk about the first ever Child Sciences University, of which Dr. Saab is the founding Vice Chancellor. But right after a break, you don't go anywhere. Stay tuned. Dr. Saab, please tell us, how did this happen, such a big initiative, and coming from a public sector institution, how did you make it happen?
This was 2018 when I first presented this concept of University of Child Health Sciences. At that time, majority people did not take it as
didn't buy it
for various reasons. Obviously,
okay.
I think one of the reasons was that a few universities were created in Punjab, and because they were elevation from a medical college, people did not have a very positive impression about developing a medical university.
Okay.
And then another criticism was that a lot of people thought that child health or pediatrics is just a specialty, and if it's a specialty of medicine, then we have obstetrics, then you have surgery, then everybody will be asking for a separate university.
Why do you need to have a separate
So
university?
I think what really made the relevant authorities convinced was mainly 2-3 major things. And let me come to that.
Yeah.
One, I was able to convince them that pediatrics is not a specialty. It's a universe in its own right.
Okay.
Like you have an adult medicine and you have a pediatric medicine.
So there are
and
two
child
different
is
groups.
Two different. And child is not a young adult. It's not that you will divide the dose into half and give it to a child and the child will be fine. The child doctor and an adult doctor is totally different. And like you have all the specialties of adults, similarly you have all the specialties of pediatrics.
Okay.
So you need a separate pediatric cardiologist, you need a separate pediatric nephrologist, neonatologist, and so on. So that was the first foremost basic concept. The second very important concept was pediatric nursing. You will be surprised, and I'll give you an example. There was a small incident in Saiwal where unfortunately few newborn babies died in a span of very short period of time. And the health minister Saiba asked me to accompany her because we were going there and seeing the place. I went to that Saiwal hospital, which is one of the teaching hospitals. We went to the nursery, and it was a fully packed neonatal unit. All babies under 1 month, sick babies, 60 plus babies, and there were 3-4 nurses who were actually. And I went to one of them and asked that nurse, "What is your training in looking after these sick newborn babies?" And she said, "Sir, no, none." And I was shocked. And she said, "Sir, I was actually doing duty in orthopedics before coming to this neonatal unit, and I've been here only for last 2 days." And that really shocked me and the health minister. And on the way back, that really gave me a big impetus to convince her that this is something which we really need to do. You will be surprised, there's not a single pediatric nursing institution in the country.
So we do not have any specialized pediatric nurses?
No. They are trained on job. You do a general nursing, and then you are placed into a pediatric unit and you learn from your senior little bit whatever you need. So nobody is actually training these nurses in a way as one should be trained. Like, would you like to, if your child gets sick,
Yeah.
Would you like him to be seen by an orthopedic surgeon?
Of course not. I
Of
want a
course not.
specialist to.
You want a pediatrician.
Yeah.
Then if my baby or my grandchild gets sick, I would want a pediatric nurse to look after that baby.
Fair enough.
And I think in any pediatric setting, nursing is actually far more important when it comes to day-to-day care and round-the-clock care. Of course, we are not denying the importance of medical profession, but I think nursing is equally important. So that was the second concept which we gave to them, that we need to establish pediatric nursing program in this country, and let this institution, this university, be the first to have a pediatric nursing program. And from here onwards, what we are going to tell to the people is that anybody who is appointed as a nurse in a pediatric unit or neonatal unit must be pediatric trained.
Okay.
Because our children deserve that.
Fair enough.
It's not something which we are. Similarly, the concept also included the fact that you are going to develop a children's hospital at every divisional headquarter. Already government is spending money on 7 mother and child hospitals which are being established across Punjab at the moment. Where is the human resource coming from? Even today, in our children's hospital, which are at Multan and at Faisalabad, and in my own institution, up to 50% of faculty positions are empty because
Right
you do
now.
not have trained pediatric human resource.
What's the reason for that, doctor?
Well, it's a long training, and then you need a specialized institution to do that.
And we do not have a special.
We do not have that. We do not have a college of pediatrics and child health. We established the first college of pediatrics and child health under the auspices of University of Child Health Sciences here. Similarly, allied health professionals. For the first time ever, we have established the School of Allied Health Sciences, which will be focusing on training human resource, which will be focused on pediatrics and child health.
Okay.
Then, of course, there are other aspects to it as well when it comes to university, because university is universe.
Yes.
And this is a universe of child health.
Okay.
And universities are there to generate knowledge.
Yes.
Now, do you think that the problems of children in this country are the same as the problems of children in US?
No. It's
Or in
obviously-
UK?
It depends on
For
the
that matter,
environment,
of course
conditions.
not. So you need indigenous research to find out what are the
causes.
problems of our children, how to overcome those problems, and how to treat those problems. And that can only happen if you do a genuine indigenous research.
Okay.
So if you ask me what is the first and the foremost thing which this university is going to do, is going to do research, indigenous research.
Okay.
And what we have done in the university context is that we are going to establish 5 institutes within the university.
Okay.
One is Institute of Research in Genetics, and I will come to genetics in a moment.
Okay.
Second is Institute of Basic Medical Sciences,
Okay.
because it pertains to pediatrics, and if you're going to have so many colleges, you need that as well. Institute of Advanced Technology and Telehealth.
And
Art-
telehealth.
Yes, artificial intelligence. Things, the context and the concept of medicine has changed worldwide. Now, unless you are good at technology and you have a dedicated technology, because all your medicine is around technology now. And there are many things which you can connect. I would really want all children's hospitals and all mother and child hospitals to be connected to the University of Child Health Sciences. So there will be certain things where you can be involved physically, and there are certain things which you can do actually like
So this will be like a mother institute.
like a hub to
Hub.
all these things which and another very important institute which we are going to establish is Institute of Policy Making and Community Pediatrics.
Okay.
Now, when I say community pediatrics, it means the pediatrics which you need to do at community level,
Okay.
which is lot of it is preventive.
Okay.
Clean drinking water. If your child is not drinking clean water, he's going to come with diarrhea. Immunization. It's extremely important. If you don't immunize, school education of children, because that's something which, unless we train our children about health,
Curriculum. you have to make
curriculum
it.
should include child health or health as a subject.
Fair enough.
And then policy making. Now, at the moment, what is happening is that whenever we go to a policy making decision at departmental level, whether it's Department of Health at provincial level or at federal level,
Yeah.
you don't have indigenous data.
Ah.
How would you make a policy? How can I make a policy for Punjab
Without any
for
data.
next 5 years if I do not have a data as how many children are stunted, how many children need this, how many children are deprived, how many children are getting ill, what is the incidence of prematurity, and so on.
Fair enough.
So unless you have that data, and I think this university is going to provide that data.
Okay.
Inshallah.
Okay.
Because that is going to be our major focus in terms of developing this Institute of Community Pediatrics and preventive or sort of policy making, which is going to give you that data to make policy for this province, and not only for this province, for this country. You will be surprised that this is a novel concept. There is not a single university of child health sciences anywhere in the world.
Anywhere in the world?
Yes. So
are we the first one?
We are the first one. We are the ones who are giving this idea to the rest of the world that if you want to think differently for pediatric population, yes, people have colleges. The College of Pediatrics and Child Health in UK was 1928.
Oh.
So we are 100 years behind in that context. Even the Academy of Pediatrics, which is giving pediatric qualifications in USA, was established many decades ago. Even countries like Singapore have a College of Pediatrics and Child Health. Look at the small size of Singapore, and they have a College of Pediatrics and Child Health.
And we didn't have any single one till now.
No, till now.
Okay.
So I think when it comes to the context of the university, this is going to be something which is going to generate knowledge in terms of research, is going to educate and train people and fulfill the needs of human resource for all your community as well as for your hospitals, not only across Punjab, I would say across country.
Across country.
And when it comes to a country like Pakistan, I think we should train large numbers. We should provide human resource to the Middle East. We should provide train human resource to the rest of the world, because that's where you earn your foreign exchange. It helps your country. It gets recognition worldwide. And if you are in a position to do that, why not? You should be doing that. And I think that's again something which will be done under the umbrella of this university. We have a vision, and that vision is to be a world leader in child health.
Wow. And
so,
inshallah,
and I think inshallah
the first step. But Dr. Saab, tell me, it's a brilliant initiative, and you know what you're telling me, it's the first of its kind in the whole world, and obviously it probably others will also follow seeing this. You know, there's quite a big gap between the idea, then putting it on paper, then getting it approved, and then the physical implementation. So what is the vision for that? Like, how large would it be? How many students will it accommodate? How many like professors do you want to create? What's the vision? How are you going to take it forward?
The Provincial Assembly actually chartered this university last year in July.
Okay.
And we were notified as a university by the department later in July. But by the time the syndicate was formed and we had our first syndicate meeting, it was already October. So it's almost a 1 year's journey. Now, alhamdulillah, what we have achieved in 1 year's journey is that already we got our PC1 approved at a total cost of 9.17 billion. We acquired our land.
You already had land in the university?
Well, we had some land in the university, in the institution already. 47 canals on one side and 93 canals free space already.
Okay.
We are extremely grateful to the Pakistan Army, because another 26 canals have been given by Pakistan Army to this university, which was adjacent to our 47 canal area. So now that's 73 canals in total, where we are going to construct our main academic block, our research institute, our colleges, and allied facilities like auditorium and so on.
Fair enough.
And on the other 93 canals, we are going to have the complex of the university, where you have residences, you have hostels, you have all other allied facilities which any university should have. So we already got our PC1 approved. We got the earth breaking last week. Very recently on 10th of December. The actual work is going to start inshallah next week.
Very
so nice. And the phase 1 project is going to be completed in 20 months inshallah.
In 20 months from now?
From now. Already 1.1 billion has been released by the government of Punjab already for the university. And of course the remaining would be as the project will be. Another very important milestone is that you are not a university unless you are recognized by Higher Education Commission. We are the fastest ever university being recognized by HEC.
It has
already been recognized. We got that recognition on 9th of December. this year.
And 10th you did the earthquake.
Earthbreaking. They visited us in November and they inspected all the facilities, which they were extremely happy that whatever work we have done in the last 1 year to make it happen in terms of university, and they have already allowed us 18 programs, of which includes pediatric nursing.
Wow.
It includes BSc pediatric nursing, post-RN as well as genetic pediatric nursing.
Great.
It includes 10 other allied health sciences programs which we are going to start in terms of pediatrics and child health.
Okay.
So I think, alhamdulillah, we are on our way.
And what about faculty?
The faculty of Children's Hospital has become the faculty of University of Child Health Sciences. Now, what we have done in addition to that is that we have 3 Professor Emeritus who were part of our faculty and now become faculty.
Yeah.
We have signed MOUs and invited different people nationally and internationally.
Okay.
I'll give you an example. A very renowned pediatrician who is visiting us tomorrow is Professor Zulfikar Bhutta.
Okay.
Professor Zulfikar Bhutta was one of the icons in pediatrics. He was president International Pediatric Association. He's currently the Associate Dean, Hospital for Sick Kids, Toronto. And he's going to be the faculty of this institution.
Wow.
He has already accepted that offer.
Wow.
And what we are going to do with him in collaboration with Sick Kids Toronto is to start our BSc nursing program. They have already done it in Ghana,
They've done
one
it
of the African
successfully
countries.
in
They have
Ghana.
run it successfully in Ghana.
So you're going to replicate the model.
We are going to replicate that model over here with his help. And similarly, because we have different institutions which are actually already connected to this institution, once you become a university, then the horizon becomes much bigger.
Huge.
Then
Wide.
it becomes huge.
Yes.
We are already getting requests from other international universities. We have recently established a clinical trials unit,
Okay.
and which was approved by DRAP.
Oh, okay.
And getting DRAP approval probably
Is
is not
one
an
of the
easy,
most
not an easy
toughest
thing.
things.
Yes, and we have just been recognized as a clinical trials unit as well.
Fair
And
enough.
that will open up a major area where we can collaborate nationally and internationally. And now I will come to genetics.
Yes.
Because pediatrics is genetics.
Yes.
You will be surprised that we developed a collaboration with a German team. And so far, more than 30,000 children had their complete genetic workup done free of cost from this institution through this collaboration.
Wow. Awesome.
30,000 plus children have been actually, and this I'm talking about whole genome sequencing.
Okay.
I'm not talking about exome sequencing. Whole genome means that your entire gene is sequenced and whatever information is required in terms of your genetic makeup is actually there.
Okay.
And that collaboration obviously is going to continue. And similarly, we have collaborations with various institutions. We have recently signed a collaboration with Cincinnati Children's Hospital in USA, where we are going to work on genetics of rheumatic fever. Rheumatic fever is another disease which the West has eliminated.
But we still
have
in
that.
Southeast Asia. I
Southeast
believe,
Asia, and
for
we
that.
are one of the major reservoirs of children with rheumatic fever. They are children who get heart problems,
Fair enough.
joint problems, brain problems because
enough.
of rheumatic fever.
Fair enough.
And we are going to do a multi-country project with them, looking at the genetic workup of these children
Fair
with
enough.
acute rheumatic fever.
Fair enough.
So I think that genetic institute and research institute will really open up a big horizon in terms of collaboration to the rest of the world.
This sounds like music to my ears, you know. And with so many international collaborations, I'm sure this is going to be a landmark, a historic kind of initiative, and inshallah ta'ala it will be a success. We're going to take a short break. Dr. MASOOD SADIQ is with us. We're going to talk about his personal life. How did he get into medicine? What made him reach this spot where he is right now? Because he is an inspiration for so many medical professionals and for so many youngsters. So take a short break. Don't go anywhere. Stay tuned. Dr. Saab, you hail from Kashmir, right? And I'm sure as a student you came to King Edward Medical College after doing your FSc pre-medical, and then you stayed back and you contributed so much to the health department, health division, health ministry, health profession of health in Punjab specifically. And then pediatrics, it's a unique field. You've been awarded Tamgha-e-Imtiaz. Coming from such a decorated family of Kashmir, so many awards have been bestowed upon your family. How does it feel coming from Kashmir to King Edward, and then please guide us through your journey?
Kashmir in 1947.
Okay.
And they actually settled in Gujarat.
Okay.
So our hometown actually is Gujarat. I was born in Gujarat.
Oh, okay.
But then my father actually joined Azad Kashmir service.
Okay.
And he was a civil servant and retired as deputy commissioner.
Deputy commissioner, yes.
And so wherever he was posted as assistant commissioner or whatever, we will move with him.
Fair
So
enough.
that's how I sort of got my metric and FSC both done from Azad Kashmir board.
Okay.
And I topped the Azad Kashmir board in
Mashallah.
metric and FSC. I think in terms of journey from King Edward Medical onwards.
Why pediatrics?
I think pediatrics, when I was doing my 4th year rotation in pediatrics, somehow I developed that affiliation with children.
Okay.
And I wanted to be a cardiologist actually, adult cardiologist,
Adult.
before I actually rotated through a pediatric ward. And when I went to pediatrics, then I thought maybe I like children more than adults when it comes to being a doctor. And then I became a pediatric cardiologist.
So both
Because
your wishes
both
were fulfilled.
ambitions were fulfilled. And because I was the first pediatric cardiologist in Punjab, I established the first pediatric cardiac program in Punjab Institute of Cardiology first, and then Children's Hospital later on. And that was the recognition which I got as the pioneer in pediatric cardiology in the province of Punjab. And that's why subsequently I was awarded Tamgha-e-Imtiaz as well. I think I must mention a couple of things here. One,
Please.
the support of your family. If you are going to do research and publications, and if you are going to spend your weekends on working as well, and if your wife is not supportive,
That's
and your
cutting out
family,
on your family time.
yeah. So I was cutting down on my family time, and that's why I would categorically like to mention my parents first, as really, because their support and their upbringing and the way they nurture you, I think it is what your personality is all about. And then I think my wife, because unless you have a support of your life partner, you can't really achieve all
Is
that.
Bhabhi a doctor also?
No, she's housewife.
Housewife?
She's housewife. We are very lucky. My father passed away about 15 years ago, but I think there's not a single day that I don't miss him.
Of course.
And I don't talk about him. I'm extremely lucky we still live with our mother. She's alive, Allah Ta'ala unko, may God give him long life and healthy life. So we are very lucky that she's still there. So you were asking as how the progress has been. I think it's her prayers as well. Because if you have a mother at home who sort of each time you come out of home and she's there to pray for you, I think this is something which you are extremely lucky in that context. Pediatric cardiology I did from UK. I was very lucky at that time, did my MRCP fairly quickly in pediatrics. So I had that opportunity. If you do it within 1 year, then you have opportunity of doing a subspecialty. So I was trained in pediatric cardiology in some very prestigious institutions like Hospital for Sick Children, Great Ormond Street, Birmingham Children's Hospital.
Oh, okay.
And then I returned and started the pediatric cardiology in this country. I've been very lucky because the government of Azad Jammu and Kashmir actually gave me a presidential medal this year.
I heard.
They normally give awards. This is a recent thing. They started a few years ago, but they
fourth year or fifth
4 or 5 years. They decorate people who are originally from Kashmir,
and
but are serving in the rest of the world and have some achievements in their field. So I feel extremely lucky and blessed in that context as well. Contribution in terms of pediatrics and pediatric cardiology, I think pediatric cardiology is very close to my heart.
Okay.
And I take my fellows as my children, honestly speaking.
Okay.
And I've been extremely lucky because there was no pediatric cardiologist in Punjab. And now I have 24 my own trainees who are professors now, some of them actually associate professors and otherwise who are working in various institutions, not only across Punjab, I would say across Pakistan.
Okay.
And they are mashallah delivering a very good service in pediatric cardiology and cardiac surgery around the world.
Great. So Dr. Saab, just an off question. Usually for students, they think that medicine is a very serious profession. And usually the bookworms or the, in slang we call nerds, they usually opt for medicine. Were you a naughty kid, a normal kid like us, or were you the studious type?
Well, I must admit I was a relatively studious. Not that I wouldn't, I was a fan of cricket.
You're a fan of
And,
cricket?
I'm a huge fan of cricket. I would wake up at 3 o'clock in the morning
To watch cricket?
And no.
And to
At
play
that time,
cricket?
there was no watching.
Ah, okay.
You used to have a small radio
Oh,
attached
okay.
to your ear, and there was a cricket match. Javed Miandad and
of
Imran Khan are
course.
playing in Australia and New Zealand,
yeah,
and
yeah.
you are listening at 3 o'clock in the morning,
Yeah.
waking up. Even sometimes in the classroom, you will take your radio with you. and
Cricket is
you
like a
want to-
fever here. Yeah.
So cricket was my always a love, and still is a
It
love.
is.
But I used to play hockey as well. I was very a reasonably good player of squash as well. I used
So you
to
were
play
sporty?
that. Yes, not sporty, I would say, but I would like sports.
To indulge in sports.
And used to play squash in King Edward Medical
Great,
College
great,
as well.
great.
But otherwise, I think I would spend more time in
study.
studies and
Yeah, of
research
course.
and otherwise.
There are some
then,
professions
yes,
that you
where
have
it's
to.
your demand.
You have
And
to.
unless you, that's the advice I would give to my youngsters as well. I think a lot of us talk about quality of life, and which is
Yeah.
extremely important. And
Yeah.
I think people don't want to spend any extra time other than what they are supposed to.
Yeah.
I think medicine is not a profession like that.
Mhm.
Medicine demands a bit extra.
Yeah.
And you have to really put in extra. And unless you work hard and you give something extra, you will not achieve something extra.
And unless you have passion to serve
Oh, absolutely.
people, this is not going to be a
That's why
possibility.
people used to say that doctors are chosen, actually.
Yes,
They are
doctors.
not made,
They
they
are
are
not,
chosen.
they are chosen.
And unless you have somewhere deep down heart that feeling that you want to be a doctor and you want to serve humanity or people, I think then you're not doing justice to the profession.
Absolutely.
And I think that's something which I would advise to my youngsters as well, that please do have a heart.
Yes.
One of our senior professors, I still remember, Professor Shaukat Raza, late, used to say, are you an army officer or a police officer and you take your belt out and you think that you're done? You are a doctor.
yeah.
If there is a sick child, you stay there unless you make that child better.
Better.
Whether
right.
what time it is irrelevant.
Is irrelevant.
And I think, I know it's hard to convince people on that
Yeah.
point of view, but that's something which I
Yeah.
feel. And I think that's
Absolutely
how
right.
you need to think about your profession, and only then you can really make
An impact. Absolutely correct. Serving humanity, being humane, that is part and parcel of being a doctor. We're going to take a short break and show you exactly where this new University of Child Health Sciences is going to be placed. So stay with us, stay tuned, we'll be right back. Welcome back, viewers. I am here present at the foundation stone of the University of Child Health Sciences, Lahore, the first of its kind university that's going to be built in Pakistan, and it's going to be the first in the world. And I have with myself Dr. Idris Anwar, who is the project director for this university, this initiative, and of course, Professor Dr. MASOOD SADIQ. So, Dr. Saab, I just wanted to show my viewers physically and in tangible terms where this university is going to be located and how the work has started. It's such so heartwarming. So just tell me, could you just brief me a bit about the premises?
Yes, this is going to be the main university campus here actually. It will have a academic block, a library, 3 colleges I mentioned earlier: College of Pediatrics and Child Health, College of Nursing, College of Allied Health Sciences. It will have an auditorium which will house 500 people. It will have an area of common facilities where you will have bank and examination halls and other areas which you actually are part of any university in that context. So actually this entire campus, which is 73 canals.
All the land that you see.
Yes. And as I said earlier, we had 47 canal, another 26 donated by Pakistan Army. So 73 canal will be actually the main campus of the university.
Okay.
And then we have another 93 canals on the other side,
Residential.
which will be residential, where you will have hostels, residential, mosque, and all other support facilities which you normally expect in any university.
Awesome. Doctor, when I was coming here, I saw this place, Sarai. Is that what is it? Is it a hotel or what is it?
This is Parents Inn. As you know that we have a policy that we normally would only allow mother to stay with the child.
Okay.
So the fathers, they come from all over the country.
Okay.
So the fathers tend to stay in that sarai.
Okay.
And I wanted to highlight another very important point here, that this sarai has not been built by the government.
Okay.
The original sarai was built by friends of children. We have been extremely lucky in this hospital, I must admit that.
And one other organization which I would really like to mention, and I'm their honorary chief medical advisor as well, is Pakistan Children's Heart Foundation. Pakistan Children's Heart Foundation was established about 10 years ago and has been supporting us. We had a recent fire incident, very unfortunate in the institution, and then we were in a fix as how we are going to look after our children with that policy of not charging anybody. And they came forward and said, Dr. Saab, for next 3 months, all children who need operation, we will fund that.
I would definitely agree with you, Dr. Saab, and I think Pakistanis have a big heart. And you know, whenever there's a noble cause or whenever they see that something material is happening, they do not hesitate to donate. And this is our quality, that this is our USP basically. Dr. Saab, it was such an honor being with you today, and you know, I'm sure the viewers would have enjoyed also, and I wish you all the best with your initiative. Alhamdulillah, Pakistan will be the first country to host this kind of a university all over the world. Thank you so very much. Thank you so much, Dr. Saab. All the best to you for your project. Ladies and gentlemen,
Thank you.
pleasure, Dr. Saab, pleasure. Ladies and gentlemen, this was today's episode of Sky is the Limit. And we met Professor Dr. MASOOD SADIQ, who has created a difference in the field of medicine. How he created it, we learned from him. I hope you enjoyed the episode. Inshallah ta'ala, I will see you in another exciting episode. Till then, Allah Hafiz.